Sacroiliac joint dysfunction is something that people are missing consistently, and it may even affect up to 20% of patients that come in to see a spine surgeon for low back pain.
My name is Jeanne. I'm from South Africa. I am a geologist working in academia. I came to the US to seek help for a dysfunctional SI joints. And I have been lucky enough to have the opportunity to meet Dr. Hazard and Vicky, who have helped me to get to the bottom of my chronic pain.
Jeanne had been dealing with ongoing bilateral gluteal type pain for an extended period of time that was debilitating to her, to the point where she could not function in her normal activities of daily life.
The pain started about 10 years ago. It was triggered by a scuba diving incident where I lost my balance and I fell backwards onto rocky boulders. At that time, I didn't realize that I'd fractured my lowest vertebra at L5 in 2 places, and I'd herniated 2 discs at L4 and L5. But looking back now, I think that fall is probably also where I injured my SI joints. By about the end of 2018, I decided that I needed to find the right help, and the only way to do that would be to come over to the US and seek the advice of several SI joint specialists across the US. And Dr. Hazard and Vicky Sims were 2 of the people who I consulted about my SI joint dysfunction.
My name is Vicky Sims. I'm a physical therapist at Gainesville Physical Therapy in Gainesville, Georgia. Jeanne was a young lady who came to see me from Africa. She originally came with the concept that she was going to do the conservative program to see if she could get better. After she was here for a couple of weeks, we determined that we should proceed with surgical interventions.
This particular situation, Miss Jeanne had a history of a prior L4-5 and an L5-S1 fusion. She'd been or had undergone several operations in South Africa, and it never quite addressed her underlying pain or pathology.
She's really happy with how well she's feeling, and I'm very happy with the progress that she's made. I think this may answer her problem of chronic pain.
Some of the most obvious changes that I found happened quite early on in the first few days after the surgery was that I started to have a decrease in the lower back spasms, amount of lower back spasms that I had before, and also less acute pain over my sacroiliac crests and hips when sitting, because sitting was such a problem before the surgery. And then just one other small thing that was amazing to me, or which I'm very happy about, is that I was suddenly able to sleep on my sides, which for about 8 years I wasn't able to do, and that was a very happy moment for me when I discovered that I would be more comfortable sleeping. I would just like to convey my enormous gratitude to Dr. Hazard and Vicky and both of their support teams, as well as Lifespine, for just having a huge amount of compassion, and I feel like absolutely everybody who I've encountered on this journey have gone out of their way to accommodate me and try to find the best possible solution for me, and for that I am extremely grateful.